And a baby!
Excruciating bed sores, vanishing twin syndrome, and ay caramba. What the heck is happening here? Get ready to laugh because today we are breaking down and reacting to the quick, diabolical medical scenes and ridiculous injuries from Family Guy. Let's dive right in.
I don't care. I'm coming with you. Well, you're not going to sit with me. Oh, come on. If I don't, I'll get stuck next to that guy with the heavy hands.
Hi, doggy.
Oh.
Serves you right.
Some people just have big hands. Sometimes people may have big hands when they have acromegaly, like Andre the Giant. Their pituitary is basically overactive and could make your structures larger.
And a baby!
Skin being pulled back. When somebody comes into the emergency department and their eyes are red like that, we label it as scleral injection. That's the medical term that we use. Sometimes it could be really red due to a foreign body, could be related to a scratch to the eye or an infection.
Hey, Chris, hey, you remember that kid you said was bullying you at school? Well, here's his head.
You see the head just dripping with blood. I would anticipate that it's not going to be dripping much. If it's been in a bag for a little while, the blood will still almost try to congeal and stop. It's not under pressure anymore. It's going to form a clot, and it's eventually going to stop bleeding like that.
That's not even him. That's the deaf kid.
Oh,
That was
gosh.
sign language. I thought he was trying to defend himself with terrible karate.
That's so messed up. That is so messed up. There are situations in the hospital where we have individuals that are deaf and they have to use sign language. We actually don't have any interpreters in the hospital to help, but we have iPads that connect to remote translators of almost every single language.
You can't fire a writer in the middle of a show. That'd be like a doctor leaving in the middle of a surgery.
Help! I'm supposed to have surgery, but my doctor disappeared.
Oh, you would think if somebody's open like this on the operating table that they would be under general anesthesia, they'd be hooked up to the cardiac monitor and not being awake, but rather asleep on medications.
Okay, Josh, this is the shot you've been waiting for.
Oh, geez.
Okay, Derek, this is the shot you've been waiting for.
The individual is still having a laparotomy, which is basically open abdomen. They do have appropriate, basically probably clamps in there that look like scissors, but then just a bunch of knives that looks like just sticking out of the abdomen, which wouldn't be appropriate.
How the hell am I going to quit
Oh,
smoking?
Doesn't look good.
Smoking could just quit me instead.
You could tell if somebody's been a chronic smoker for a while. They do have skin color changes. It doesn't just mess with your lungs, it messes with your whole body. Please don't smoke. There's no actual benefit for smoking.
Thank you for meeting me here.
Oh my
I
gosh.
have something very important to tell you.
I have something important to tell you, too. Peter, I think we should see other people.
Okay.
The cigarette has Peter's chin. I love it. This is a picture of a sonogram. We don't print these out in the emergency department for individuals. Maybe in the office at the OBGYN they might. But most of the time, if somebody wants to see a picture, we'll let them take a photo of the screen.
Oh, look, Chris, here's your costume from the year you won as a condom.
What the hell are you supposed to be?
Oh, that's so funny. Okay. A condom is a barrier device. If used appropriately, has a pretty high probability of reducing pregnancies or unwanted pregnancies, as well as transmission of sexually transmitted infections. Oh my gosh.
I can't believe it. You've become a wild animal. You're like that tiger from Siegfried and Roy.
Oh.
I think we all know the answer to this, but should I get tested?
Siegfried and Roy, one of them got mauled by their own tiger, so here he's in the hospital. Wearing a cervical collar, so if the collar is still on, that means that there's a cervical fracture. Multiple abrasions, typically those would be covered.
I haven't felt this powerful since I got to decide which ant lives and which ant dies.
Oh gosh.
You shall battle to the death, and the winner will be given his freedom. Why are you looking at me like that?
Peter, would you like a glass of... Oh, my God!
I need to talk to Coyote Peterson about insect bites and ants. We don't see this in the emergency department. Most of the time when somebody gets bitten by an ant, we will see them due to the fact that they're having an allergic reaction and have to deal with the anaphylactic component.
Peter, you are taking Stewie to the park. It'll do you good to spend some time with your son.
I spent lots of time with him, Lois. Just last week, I took him to the doctor.
Mr. Griffin, you're here to
Aw.
get your prostate examined?
Yeah, this is me.
No. It's very funny that he brought his son to the doctors, which he shouldn't in general when people bring family members into the ER when they're a patient. We don't like that because it's a sick place. There's infectious diseases, so we don't recommend it.
Besides, it's bound to go better than my deep sea training. Well, we got a long time in this decompression chamber. You guys mind if I turn on the radio? Peter!
Oh my gosh.
Hey, excuse the hell out of me for trying to brighten your day with music.
Oh my gosh. We use different type of decompression chambers or hyperbaric chambers. A lot of times carbon monoxide poisoning is one of the indications that we will dive somebody.
You idiot, use your brain. You're an idiot.
It's all gonna get caught. Yep.
Stop. Oh man, we're gonna need some butter or something.
Eyes popping out like this, so the anatomy is wrong. You have 6 muscles of the eye plus your optic nerve that comes in with the blood vessels, so they wouldn't look like this and swing it around. They wouldn't come out that far.
Oh man, this is gonna be great.
Oh, are we watching a movie?
The lab results are back. You've tested positive for nymphomania.
Oh no!
There's no lab test for such a thing.
What should I do?
Take 2 of these and call us in the morning.
So bad. Oh my gosh. Obviously, these 2 doctors are creeps, but hey, they do say take 2 of these and it should calm things down, essentially. If life has you feeling wired, you should check out Chillax by my company, Life Happens. Check out chillax at lifehappens.com or on Amazon. Tea Fairy. Oh, Tooth Fairy. Oh my gosh. Oh, gross.
Yeah.
That is so gross. All of these teeth are molars that we can see here, so they have multiple roots versus incisors. Oh, there's like 1 or 2 incisors. But these were definitely teeth that were pulled out. If you see the roots versus if they were baby teeth, you wouldn't actually see the root as much.
I can make things happen when I want to. Just ask my twin brother.
And here's baby boy number 1. I understand you've decided to name him Stewie.
It's just funny to me because Stewie comes out of the womb, no umbilical cord, and it's the cleanest delivery on the planet because there's no blood or fluid on the baby.
1 more to go. And here he... Oh dear.
Oh no, did Dave not make it?
There's something called vanishing twin syndrome where twins, triplets, disappear, get absorbed by the other baby, die in utero. There are many different scenarios that could potentially happen, but it actually is a true thing. It's just Family Guy takes it to a whole nother level.
Mayor West is crazy. He should have been locked up a long time ago.
Yeah, there's definitely something off about him. I'm his physician. Okay, now we'll just test those reflexes.
Hey, did you hear that? There's someone out there.
Not even hitting the reflex in the right place. You're supposed to hit with the reflex hammer at the patella tendon. Why do we use the reflex hammer? We're checking for deep tendon reflexes.
Do you have any experience helping out people with special needs?
Well, I did work for that old lady down the street.
Meg, could you come here, please?
What is it?
Oh my
Could you
gosh.
see if I'm getting a bed sore on my back?
Bed sores are basically sores that occur from laying in the same position and on the same tissue for an extended period of time, and the tissue starts breaking down.
Sure.
Oh, that is awful. This is very common. Unfortunately, once they start getting pretty deep, it's really hard to recover from unless you're really aggressive at treating them. I've seen them all the way down to the bone.
It's in the bone. It's in the bone.
Basically a sign that somebody's not helping them and rotating them as best they should. Holy cow, a lot of fast clips going on, a lot of material thrown at you guys. Hopefully you absorb some of it. If you guys enjoyed this, definitely check out this playlist right here, binge watch everything. And as always, do me a favor, subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.